Bismillahirrahmanirrahim. Sorry for the disturbance. Now come towards the point of manufacturing or the formulation to be used with the wrong strength or contaminants or adulterants, wrong or misleading packaging. I'm hoping that you have the clear concept of this contamination of during the manufacturing. Next point is dispensing the formulation. Yes, when we formulate the medicine after formulation, there is a dispensing error, and it is on the pharmacist side that the wrong drug has to be dispensed, or pharmacist may dispense the wrong formula or may dispense with the wrong label. That is, the label has some incorrect information. And next point is administering or taking the drug with the wrong dose. This kind of error was on the nurse's side, and these checking was done by the pharmacist also, that the administration or the taking of the medicine with the wrong dose, with the wrong route, or with the wrong frequency, or with wrong duration also add in the medication error. And after all these kind of error, mm, if monitoring was not done, and inappropriate monitoring or failing of the monitoring, it will also fail the therapy of the therapeutic outcome. And these kind of failure of therapy and failure of monitoring may cause some, may also increases the chances of medication error. There is a figure in this slide, and this figure also has a reference. You may see the references in the end of the slide, and uh, we show it in the uh, these are the lines in which I give you the references, so you may check all these information from the internet. In this figure, classification of types of medication error based on psychological principles. For example, these, what are the psychological principles? Errors. What are the errors? When actions are intended but not performed. Basically the mistakes, basically the errors in the intended actions but not performed. And there are some sort of classification. This classification is, errors are mistakes, errors are skill based error, which is included slips and lapses. And what are the mistakes? The mistakes, errors in planning actions. When you plan the actions, there is some mistake due to some low level of knowledge or some low level of expertise. You may mistake in the plan the actions. So what are the mistakes? Mistakes are also of two types. One is knowledge based error, that is, the physician, the pharmacist, or the nurse have not enough knowledge and they make mistakes in practices. And second one is rule based error, and the good rule not applied or misapplied, or the bad rules are applied. So these two kind of mistakes may produce the errors. The another kind of error is slips and lapses, the errors in executing correctly planned action. Yes, these are the action-based errors. Right, action-based errors are called slips, and slips all are due to technical errors. And the second one is memory-based error, which is also called lapses. Lapses is the gaps that is during the practice, during taking the action, you miss some point and you did not memorize it. Okay, um, whether we give it or not. So these kind of slips and lapses are also happen in the practices, and it may um, lead to the medication error again. The next, what are the examples of these kind of error? The knowledge-based error. Knowledge-based error are being unaware of the interaction between warfarin and erythromycin. The pharmacists don't know the interaction, and the outcome of these kind of less knowledge is the toxicity. Uh, it may cause the toxicity. The another one is rule based. what we study in the figure, that second kind of mistake is rule based, that is the not implementing a good rule or the bad rule implemented, that is prescribing oral treatment in a patient with dysphagia. Dysphagia is a disease with your related with your oral cavity, and you should avoid the oral treatment. So lung expiration or failure to treat is happening. And action based, yes, the slips, you may also call it slips, and being distracted writing diazepam for diltiazem. The prescriber want to write the diltiazem, and besides writing the diltiazem, it is diazepam, and it may produce the sedation. And what are the technical errors? The technical errors, that is writing illegibly, that is handwriting are so worse that Panadol is read as Pyradel, and um, besides taking the Pyradel, the desired objective is to reduce is to have the lithium in the context, but the prescription writing is so worse that it read as Panadol and there is no effect produced. And memory based as forgetting to specify a maximum daily dose for as required drug, and it may cause the poisoning or unnecessary treatment or overdosing, because you forget about the maximum dose, daily dose, and it may cause some kind of emergency treatment. So these kind of error, there is example and the outcome of errors are there. And the next is types of error during medication error. These are the types of medication error, and medication error are categorized in prescription, dispensing, and administrating error. These kinds of error may also carried by the healthcare professional and by patient also itself, and the patient are on the over-the-counter medication by self-prescription and self-administration medication at home, that is self injection, or have the oral supplement. The prescription error. What are the prescribing error? Prescribing error may be defined as the incorrect drug selection for a patient. Such errors can include the dose, the quantity, the indication of prescribing of a contraindicated drug, lack of knowledge of the prescribed drug, its recommended dose, and of the patient details contribute to prescribing errors. So the prescribing errors are, with the definition, you may also have the inappropriate or incorrect selection of the drug, and irrational drug selection. So it may include the dose, quantity, indication, and prescribing of a contraindicated drug. Maybe the drug is correct, but the dose is incorrect. Maybe the frequency is incorrect. Maybe the indication is incorrect. Maybe the contraindicated drugs are prescribed which physician not know about it, and lack of knowledge of these prescribed drugs, the recommended doses, and the patient details contributing the prescribing error. What is prescribing error involves the illegible handwriting. I again say the handwriting is so worse or so poor that it may read something else which is to be prescribed. The inaccurate medication history taking. Yes, it's from the physician side, the history taken by the physician, the junior physician, or the PGs, it was inaccurate, it was not audible to the prescriber, so and patient, there is some constraints within the patient and the prescriber also, that there is some lingual barrier or some sort of audible barrier. So history was taken inaccurately. There is another prescribing involves the error involves the confusion with the drug name, that is not remembered in its original name, or there is some sort of brand name confusion. So again, another prescription error involves the inappropriate use of decimal point. This is very important point, that during writing the doses of the medicine, there is sometimes the use of decimal is very um, important to check, and it has also its significance, that is inappropriate use of decimal point may cause the overdosing or underdosing of the medicine. A zero should always precede a decimal point. If the decimal is like this, that is there is point 0.1, so 0 should be written on that. Similarly, tenfold errors in those have occurred as a result of the use of trailing zero not mentioned, preceding zero should mentioned, and use of abbreviation that is AZT has led to confusion between the cytidine and azathioprine, so the abbreviations or the acronyms should not used when prescribing the medicine. The generic name has to be taken and it should write in proper writing, and it should with nice writing, and it should write with its own original name, not the abbreviations used, and use of verbal order should be um, not entertained by the pharmacist at the dispensing counters. There is an example. This is a prescription order by the physician, and for your ease, I tell you this is the insulin, the Lantus, and regular insulin. The first one is Lantus, and the second one is regular. And there is units are written, and it was reading as uh, the, the the numeric data as 4 and 4. It is just like 4 and 4, rather than the prescriber want to write 4 unit of Lantus and 4 unit of regular, and the another healthcare staff which is responsible to dispense or administer this insulin, he or she may read this as 44, and it may produce the harmful or um, effect as the prescriber want to give only the 4 unit to the patient, but the administration at the administration point, the nurse with this you taking as 4, and he or she administer the 44 units, and it will cause the lethal or fatal effect to the patient, that it may increase the dose tenfold. Now the dispensing error, what kind of error is? It is at any stage of the dispensing process, from the receipt of the prescription in the pharmacy to the supply of a dispensed medicine to the patient, and it is on the dispensing counters, it is by the pharmacist, and it is during the supply of medicine from the dispensing counter to the patient in the hands of the patient. And during the time, during the course of this treatment, during the course of the everything has gone right, but at the counter, if the medicine, if the prescribed medicine is correct but the dispensing medicine was incorrect, and it may cause the lethal or fatal effect to the patient if the patient take this. And these kind of errors sometimes due to look-alike sound alike medication, that is the Lassa effects, and take this picture as an alarming, that uh, if the Warren injection and the Acuran injection are in the same kind of ampule with the same labeling ink, that is Warren is for V and A, Acuran is for A, and both ampules are like look alike, and if the patient get Warren instead of Acuran, or Acuran instead of Warren, so the lethal or undesirable effect may produce, and it may harm the patient, and another course of adverse event may occur. Same as in the packaging. Yes, this is the packaging material which I show you. These are the Sandoz products. Sandoz products are not available here in the market. We have another examples. You may collect these kind of examples, the Lassa example, and show to me during your clinical round what are the impact by. So here is your okay, students. Here is your one assignment that you may collect the Lhasa and medicines look alike and sound alike medicine, the packaging, the labeling, which are very much similar to each other, and collect these kind of medicine from the stores, from the um, market, and at the end of the your clinical clerkship, you show to me, and I will give you the um, points on this your activity. Here is a small activity that you collect the Lhasa medicine from the market and the stores. Now next is Lhasa risk in Pakistan. How many medicines are look-alike? There is 104 medicines in Pakistan identified as look-alike and sound-alike among around 70,000 registered in the country, prone to causing confusion. And of these 104 medicines, 35 are a serious cause of concern. Collected from the market. Again, I tell you what is your assignment during these days is to collect Lhasa medicine from the market or from the different stores, collect it, have a sample of it, and show to me at the end of the clinical clerkship program. We can gather the data, and we can make we will make some sort of conclusion over it in the form of writing some script on it for the editorials and for the our pharmaceutical journal. Okay, this is another example, and it is banned in Pakistan now. This is an old example. So collected the new example, and we will include in our upcoming events, inshallah. Another error is administration error. Okay, administration error occur when a discrepancy occurs between the drug received by the patient and the drug therapy intended by the prescriber. This kind of error was taking has long been associated with one of the highest risk areas in nursing practices. Oh yes, administration was done by nurses, and at that point, if the medicine wrong dose was administered, everything was gone okay. But at the time of administration, the medicine error was intended by the nurses that during the course of administration, the wrong drug was given to the patient or the drug was given to the wrong patient, it may produce the harm or cause of the death towards the patient. What are the 5 R's which we should know, we should understand, we should learn, and never ignore our right drug with right route at right time in the right dose to the right patient. And there is another point of high risk medicine. What are the high risk medicine? Uh, how many kind of it? And there is a long, there is a you may call large information about the high risk medicine, but how you conclude it uh, in a single format is a pinch. Uh, to memorize this high risk medicine, what are the categories? Um, you just learn the acronym of A pinch. A stands for anti-infectives, all kind of anti-infectives, including antibiotic, antiviral, antifungal. These are high risk medicine. And what is pinch? Pinch, P stands for potassium and other electrolytes. I is for insulin. N is for narcotics and other sedatives. And C is for chemotherapeutic agent. And H for heparin and other anticoagulants. If you remember this A pinch, you remember what kind of medicines are on higher risk, and they should monitor, and it should be monitored during the course of treatment. There is a pamphlet. You may also design a pamphlet. High risk medication, a pinch, a pamphlet. This pamphlet has designed in another country, and I take it as a sort of as a kind of example in your presentation that you may also design this kind of pamphlet, the high-risk medication, the acronym A-PINCH is designated to serve as a reminder that even routinely administered medicine pose a high risk. You may design this pamphlet and show it in your stores and provide it in the areas where the dispensing counters, especially in medical stores and in pharmacies, to memorize what kind of medicine should be monitored, should be counseled, and these are high risk medicines. They should be double checked. They have a labels of high alerts, and again, this is a pinch. And the next is the case study. In the previous year, we have listened about it, a case of a little angel in our healthcare facility of Karachi. Beautiful smile with a beautiful smile, and some incident, unfortunately, administration error lead to her death. What is the administration error? Administration error of potassium chloride, and at this moment you should know about the potassium. You should know about the electrolyte imbalance, and whenever the electrolyte imbalance is there, the pharmacist should um, having alert on his or her mind that what is the calculation of these concentrated medication available in the market, and you should have a formula to dilute it and administer to the patient. If it is not, if it is in the paramedic, if it is in the hand of nurses, it may harm to the patient, it may lead to the patient. So the pharmacist responsibility is very much high in these areas when the intravenous injections are administered. So you should know when the intravenous therapy has to be switched. And for this case, if the potassium level in the blood is 2.5 or above 2.5, the oral supplement can control the potassium level. But if it is less than 2.5, then switch to intravenous. So not all the time intravenous therapy is required. So all these things should be in our file, in our memorandums, uh, in our expert advices, that when and will we switch to the oral supplement, and when and we will switch to the intravenous. And if it is intravenous, then we should dilute according to the weight, according to the age, and according to the concentrated strength available in the market. So potassium chloride, the molecular weight of this is the formula is KCl. This is a small l. Sorry, it is the writing mistake in presentation. That is K is capital for chloride, C is capital, L should be small. The molecular weight is 74.5 milligram, which is equal to 1 millimole or 10.07 milliequivalent. And here is some description. The first point is if serum potassium level is less than 2.5 milliequivalent per liter, use IV instead of oral. But if it is more than 2.5, do not use IV until it uh, decline to the 2.5 milliequivalent per liter. Available strength is 7.46 percentage in 20 ml ampule container, which is equal to 20 millimole or 20 ml. And what is it is doses? The recommended doses is zero point 0.2 millimole per kg per hour, and each millimole of potassium is diluted in 25 ml of 0.9% NaCl. So it is recommended, that is the container is of 20 millimole and the dose is zero point 0.2 millimole, that is the 1/10 of the available strength per kg per hour, and each millimole, it is recommended that each millimole of potassium must dilute in 25 ml of 0.9% of NaCl. Example of this patient is 10 kg. This patient was of 10 kg and zero point 0.2 millimole per multiplied by 10 is equal to 2 millimole per hour. That is, and for why we should take this as per hour, that after every 2 hour, the level should be checked because as intravenous infusion therapy was started, the level was escalated in a very fast manner. So it should take as after every 2 hours, the electrolyte should be monitored, or it will not taken as a continuous IV for the prolonged time of period. So the dilution was taking as take 2 millimole or 2 ml of KCl diluted in 50 ml of 0.9% NaCl. That is, every millimole should diluted in 25 ml. If the dose calculated as 2 millimole, then it should dilute in the 50 ml of sodium chloride, and the infusion rate is 60 minutes, that is per hour. That is, it is should be infused, the 50 ml of the infusion should be infused in the 60 minutes, and for 1 minute only 0.83 ml per minute should infused, that is less than 1 ml. And the caution is monitor serum potassium level side by side the ECG changes, and reduce the infusion rate as its minimum level as the ECG changes, and potassium level until up to the mark. And the most important one is warning is label it before administration, that everyone should know that KCL should be administered. KCL was administered, and it should be labeled properly as high alert medicine. And if it is not labeled with a red label of the high alert medicine during the administration, the nursing and the healthcare staff did not take the ECG changes and the electrolyte changes in an appropriate manner. It may cause death, and it may cause the lethal effect on our um humanity. And this was the very sad incident, and like this how many incidents happened, we don't know the exact data of the medication error in our institute also. So it is the duty of the pharmacist also, it is the very high responsibility as a healthcare professional team, that we should monitor the prescriptions, the doses, its accuracy, and its monitoring parameters, and its dilution and the rate of infusion. Everything is important, everything has its own significance, and we should know about it. We should address the chances of error, and play a key important role in our duties, in our responsibilities during the, especially not only in the practical life, but also during the clinical clerkship and at our institute. When you have around, when you take the patient profile, then you should take the medicine charts and observe it, report it if it is some kind of error. Thank you so much for your time. Thank you for the lecture. And I am hoping that you have a great time in our institute and learn a lot of things like the previous years. Thank you so much.